Hey guys, I'm going to show you how to set up a breast pump and then a little bit about cleaning and before and after care with it, and then I'll show you how to measure so you can get the right flange size and nipple shield size. So let's start there. So when you have a mom that is asking for like a nipple shield, or you're setting her up for a pump and you need to figure out what size insert to give her, or what size nipple shield to give her, then we're going to take our little measuring card and you're going to cavity wipe before and after into the holes and then let it dry so that it doesn't touch mom's skin. And then when you come up to measure mom, you'll have to kind of like either ask her to do it or just kind of find the base and pinch a little bit and stimulate, you know, obviously not too hard to hurt, or you know, you don't have to press too hard, but it should start to, like, you'll be able to find the base of it. That's what you really want to do. You don't want to just put it on. You want to make sure that you're like pushing and feeling, and if you do that, you'll be able to feel like, oh, I do have the base, I know where I'm at, and then I'll stimulate it. And then you'll take your ruler that we have here, and you're going to try to just slide, you know, kind of estimate like what fits the best without forcing. So that's 14 and that won't go through. So just keep going up until you feel that fits perfect and there's not hardly any space. If you lose mom's nipple, stimulate again so that you're getting an accurate measure. And so this fits perfectly in the 15. So the rule with that would be to go up 1 to 3. I like 2. You know, some others like 1. It just depends on, like, I've been nursing, I've been pumping, I'm a little swollen, then maybe only go up 1. But if she hasn't had any stimulation really, she's exclusive pumping, it's the first time, then you maybe go up 2. So we have in here is all of our flange inserts. We try to put some in the nursery as well when we're gone. So we have 15, 17, 19. I think we have 18 as well. So hers would be perfect. So she measures 13. I'm going to give her the 15. And then if I'm doing a nipple shield, then you're going to see the sizing up here. This says medium 20 millimeters, but we have a small that's 16 millimeters. So that would probably fit this mom better as a small 16. So you want to be closer to her in size. Obviously we can play around with the sizing on that, but I just wanted you to kind of know how to measure and feel confident with that. And then after you're done, you'll cavity wipe through the holes front and back, and then there's one of these in the nursery, or if you happen to come in our office and grab it, then just put it back when you're done so that we can always have that. So if we're moving on to getting mom to pump, then you're going to go into the nursery and you're going to grab the pump kit, a soap. We ran out of basin, so you want to grab the basin and you want to grab syringes, and we're out of syringes as well right now. But they're the purple syringes meant only just for pulling up the colostrum. That should get the little bits. So what I do is I go in and when I grab the kit, I go ahead and grab all the supplies that are right there with it, and I grab a basin. And then we have like a pump sheet handout where all the breastfeeding packets are, just right below. It's like the third or the fourth rack, and you'll grab the pumping rod or record. But if you don't grab it, that's fine. But that's what I do. I just grab everything so you can go in once. When you go in the room, it's gonna be loud. Our kits come with a manual handle, so make sure that you show mom how to use these and not to discard it. So just kind of like take everything apart, and you're gonna see on here there's a little space right here. I don't know if you can see it, but between this connector there's a little space. Go ahead and take and push that all the way in, and then if you see this is like kind of off or that's bubbled in there, go ahead and push your hands around and make sure that it's flush and it's on there, or else it could impede the suction. So go ahead and do that with both of those. Push it on there and kind of get your tubing ready. Before I head over to the pump, I want to show you a few things about our kits. If you can kind of come in, you're going to see this lid, 2 lids, and that goes to the bottles. And then you're going to see these lids, and they go to these colostrum collectors, and like that. So that's what those are. We have more of these in the nursery in a bucket by the soap. And so if you can kind of see how that came like that, do you see how that's, so that's not going to provide good suction. It's not on all the way. So we want to teach moms like, hey, when you go to pump, make sure that you push that all the way down. So there's no, this is what is going to create that suction. So if this is not there, no suction. But whenever she cleans it, she's going to take everything off, take everything apart to do that. Okay. Hot soapy water, let it air dry, and then reassemble it for the next pumping session. So this you just kind of tilt and twist and it'll come off. These will need to be replaced kind of every 2 to 4 months if they stay with this pump. This is a, let's see if you can see this, but it's a 24, it says right here, 24 millimeter. This one is a 21 millimeter. I don't know if you can see it, 21 millimeter. So we have 2 different sizes of flanges, and that's the circumference of that. So what did we measure this mom at? We measured her at a 13 needing a 15. And so I'm just going to kind of show you why, see how much space is in between on the 21. And then here's how much space is on the 24. See, there's just a lot of space there. It's too big. It's going to pull in that areola tissue. And so that's not what we want. We want the nipple to, mostly just the nipple, a little bit of areola. So what we're going to do with this patient is we're going to take and we're going to set everything up. We're going to put this little colostrum collector on, which you're going to see a little square right here. And there's smiley faces right here. What that is telling you is that you need to have that part facing up. So any milk that is too much for this little collector will go into that venting and go down into the bottle. So this is meant to just collect those little bits of colostrum so they don't get caught in here and then we can't access them. So you put this all on together like this. I put it like the oval because it's meant to kind of support the weight of the breast underneath, but it's okay if it's not that way. We're going to put the 24 on, and then we're going to grab a 15 insert, and we're going to take this insert and we're going to put it into this 24 flange. These inserts are meant to reduce the diameter of a 24 down to mom's size. So again, these inserts are meant to reduce only the 24 millimeter flange down to mom's size. So you don't want to take the 15 and try to put it in the 21. It's only meant to reduce this circumference on the 24. And these are universal. It can go in mom's Spectra or whatever pumps you got through insurance. So you'll open these up and you'll just kind of push them down in there. So I don't waste those supplies. I'm just going to kind of pretend I centered it down here, and you're going to push and push and push and push and keep going around, and it'll be flush with it to where it's all the way in, and it's very flush with this this flange. So that's how we do measuring, choosing the right flange insert size, and how to put them in and how to assemble this. Before I put the tubing on, I want to show you what this is. So this is the manual component, and this comes off frequently, or it's not on right and then it falls off. So I just want you to be aware, again, with this thing, like with everything, you want to make sure everything is tight and it's on there with good seal. So you just push it and all the way around, and you'll feel it click into place, and it's on. So then you're going to take and put right here where we'll put the tubing, but with the manual pump you're going to put this here. You're going to center mom's nipple right in the middle, and so when mom pumps, she's going to be quick for a couple minutes, try to get the milk to let down, and then after a couple minutes, then she can switch over to, and mom can pull halfway, she can kind of flutter pump, or she can press and hold. Those are different things to do there. So you'll see it kind of just popped off, so you have to put it back on there if it does that. So if mom pulls too hard, she might pull that complete apparatus off. So then she can get into her own rhythm, do some hand massage and pump, go back into stimulation mode and go back and forth. So that's the manual pump. It's a really good manual pump. Make sure she doesn't throw it away. So if we're gonna set up the actual breast pump here, I'm gonna go ahead and put this collector on this other one so we can get it put together. You're gonna go into the pump room, and you're gonna see the pumps have these bags on them. this is how this is our procedure on cleaning and how we know it's clean. So if we get a visit from the health department, then this is how we show them that we do clean our pumps and store them properly. So anytime you discharge a patient and you have a breast pump, make sure that you wipe it all down. Come over here and you can kind of see this this oval, rubbery oval here. It's a button, so you want to push on it and then you want to lift. If not, it's not going to come out, and we don't want to. We want to make sure we're not like inadvertently like snapping it. So push this button and open. And you'll teach that to mom, because a lot of times she'll go home and she'll forget to take her tubing or something. So these just go right in place on top of here. Push them down. Just make sure they're in there really well, and then close that. Before I move on, when you discharge a patient, you're going to open this up and you're going to take these out if mom forgot them, and they will go into the trash. So frequently what we see is this. When I go into the pump room, frequently what I see is this on top, and you see these right here, they're sticking out. This is an indicator that these were just pulled off and thrown away, and this was never actually opened and cleaned. These need to come out and either sent home with mom, or if mom forgot to take them, then trash, and then we need to clean in there as well. Not with a soapy wet anything, but just with the cabbie wipe. So push, open that, take it and throw it away. So that is an indicator, if we see those in there, that this pump was never actually efficiently cleaned. And so just kind of remember that whenever you discharge a mom that was pumping, to open that up and do that. I'll plug those in here, okay? And then I'll plug this pump in. On the front of the pump is a sticker. And hopefully, let's see if you can see it. We'll zoom in on it, and it's gonna say this is the start the initiate program and start the maintain program. So if you forget what I'm telling you, remember the stickers here. There's 2 programs built into this pump, and that's with this card back here. That does it allows this pump to become a 2-program pump. So what you want to do is take your tubing, stick it into these holes. I'm going to put it behind here. Take this one, stick it into the hole. Okay. And then what you're going to do is, mom's, again, she's going to center her breasts, make sure they're nice and centered, and a pumping bra would be great, so she can be hands-free and use hands-on pumping, which will lead her to have more milk output, but until then she'll have to hold them in place. The suction will not hold them on by themselves. Mom will have to hold them in place. So we'll push this start button right here, and then you're going to come over and you're going to hit this milk drop button, because that's what's going to put it in something called the initiate program. And if you didn't see that, it'll say, turn it on, initiate, press the milk drop, which is right here below. And that's going to put you into initiate program. This program turns off by itself in 15 minutes, and it does its own separate program, not like the standard maintain program. This program does not shut off for 30 minutes. So this is a 15-minute program, this is a 30-minute program, but moms don't necessarily have to pump for 30 minutes. So with the initiate program, you're going to turn it on, and you're going to push this button, and then because we added those colostrum collectors, you're going to have mom turn it up a little bit, as long as it's not uncomfortable. If it's ever uncomfortable, she'll turn it back to comfort, and that's a good spot for her. Okay, and then it's going to go through a series of quick pulls, like strong pulls, pauses. It'll pause 2 or 3 times. It's not done. It's only done after 15 minutes, and it'll say program complete. And if you miss that, it'll make a sound, high-pitched sound. If you miss that, then it'll say press power, and that's how you know the program is done and it turned itself off. Once a mom is able to collect 20 milliliters of milk for 3 times in a row, then you can move her into the maintain program, which is you just turn it on. And then you want to tell her to turn it up so she feels the pull. There's no exact number, but then after it switches over, it will switch over to the standard pull section after it stimulates for 2 minutes. And then that's where you want to tell her, turn it up to where it's a little uncomfortable and turn back to comfort, and that's a good spot for you. It shouldn't, moms will think the higher the pressure, the more milk. No, that causes damage and swelling and less milk actually. So make sure that you teach her to turn the pump on, turn it up to where it's just a little uncomfortable, and turn it back to comfort, and that's where she needs to be. The first 2 minutes though is just stimulation, so she doesn't need to turn it up too much. Once it's switched out of stimulation after 2 minutes, then that's when she needs to go ahead and do that. The last thing I'll tell you about this, the maintain mode, is when this is turned on, if mom is already leaking and letting down, she can, after it says initiate, press this button. After it was, when it goes into maintain mode, it says maintain mode starting. Then she can press this button and it switches over and into the standard mode, and she can turn it down. She doesn't have to wait for stimulation to stimulate a letdown. So if a mom is coming to the pump already letting down, then you turn it on and you're going to wait till it says maintain mode starting. And once you know it's in maintain mode, then you'll push that button and she can go right into the letdown mode. The reason that these are two different programs is this is a studied program. It's in a randomized control trial by Medela. Then the participants that were in this program, it's meant for colostrum. It's meant for that early milk. So the way the erratic behavior and the suck pattern, those participants ended up having more collectible colostrum, and they ended up having milk come in sooner and an overall higher milk volume trajectory. So that's why we use this pump. The only other pump that is comparable to this would be the Spectra. Every other pump, tell mom what I just told you, 9 times out of 10 she's going to say, oh, I want that one because it's going to be a little bit better stimulation. Not that her pump is not good, it's just why not use this one while you're here. And then lastly, again, whenever you're done and mom's done, make sure that you take this completely out, send the parts home with her, and clean the pump, and then you'll get a clean bag, which these are in the pump room up on the shelf, and you'll put this over it and tie it at the bottom, and that indicates that this is a clean pump and ready to be put back in use. When you pull a pump out, you're going to see a number on the pump right here, or on the front somewhere. There's a big sticker. Make sure you just write down what room number and what date you signed that out to so we can track our pumps. And then as far as cleaning, what you'll tell mom to do after she gets done pumping, you're going to tell her to go ahead and disconnect the tubing, push them through the handle here, and then she'll just move the pump back behind her bed, and then she's going to disassemble every single part like this. She'll put it, you can either use this or the basin, and then you're going to take everything completely apart, rinse it in water, and then you'll put it in a hot soaky or a hot soak bath that with just like a couple squirts of this soap, and then after you've rinsed the parts, disassembled them, rinse them, all that, and you'll let them soak, and then she'll rinse them and let them air dry on a towel. And so this can be in her bed, right when you walk in her room, or in the bathroom, wherever she prefers. So just, you know, whenever you bring everything in, bring an extra towel in so that she has a place to let the pump parts air dry. I think that's about it. I hope this was helpful. If you have any questions, you know how to get a hold of us. Please, 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 if you can, whenever a mom is exclusively pumping, or she is not able to get the baby to the breast, or she's is a NICU baby, or the baby's early and is not breastfeeding, the ideal time from delivery of the placenta is within the first hour. 6 hours is okay. There's a better trajectory when we get them pumping within an hour of the delivery of the placenta. So just make sure moms know that. And so if we're not here, it's in the night, please, please, please just get them started. And then she'll pump every 3 hours after that. And then we'll kind of give all the handout and the education after that. So thanks, guys.